Hello, my name is Ian McCall, and this is another in the series of videos for dermatology for dentists and dental students. Tonight we're going to look at classic intraoral tumors. Now, this isn't one of my major areas, simply because some of the lesions that we're going to see here are very peculiar dental lesions, and I don't see them much at all. The one that I do see a fair bit is the irritation fibroma. We'll look closer at these later, but generally they are pink, fairly smooth surface. You can get a slight roughened surface, sometimes even a bit of ulceration if it's rubbing up against an irregular tooth edge. Usually on the labial or the buccal mucosa like this, or sometimes even on the side of the tongue. Now, these aren't really tumors. They're a benign irritation, hyperplasia, rather than new growth of cells. They can be persistent, and generally you get rid of the area of damage that's causing the irritation. You may have to excise these. The other thing I often see is a mucocele. A mucocele is basically a blocked salivary gland, and these you'll regularly see on the lower lip, as in this case here. They may fluctuate in size. They're not fixed all the time, and sometimes they just spontaneously burst and settle. Other times you can, in fact, excise them, but it's rare that you have to do that, or at least it's rare that I ever do that. And then the third lesion that we commonly see are tori, and these are bony thickenings of the hard palate, sometimes also of the mandible. And I'm not sure really if the difference between a bony exostosis and a torus. I might just flick at this point into exodontia, where they really have some nice images here of these lesions. What's an exostosis? Exostosis and a torus. Bony swellings. So they're bony swellings. Does that mean they're osteomas? I mean, osteomas are generally referred to as those arising from the periosteum, the outer table of the bone, and those that are from the medulla of the bone, endochondral osteomas. Let's see what they say about these if we go down through it. Torus is considered to be a developmental anomaly. Often does not present until adult life, continue to grow slowly through life. Yeah, torus palatinus is when they're arising from the palate here. They're usually rounded, less than 2 centimeters in diameter. Do you look at those figures? 9 to 60% of the population for palatal tori. These are ones here that are in the floor of the mouth, and they're arising from the mandible, as we mentioned earlier. And these were some others in the jaw, X-ray showing a torus mandibularis there, and this is referred to as mandibular exostosis. Exostosis is the formation of an exostosis bone mass on the outer cheek-facing side of the maxilla, just above the teeth, or the cheek-facing side of the mandible. Develop in early adulthood, slowly enlarge over the years. Okay, painless, contribute to periodontal disease. They have no malignant potential. That's obviously important. So here's a buccal exostosis, again on the cheek side of the upper jaw. You can get nodular tori, lobular tori. Fascinating. I really should look inside mouths a lot more and observe these things. This is a nice section. Go and have a look at this on exostosis and tori. That was the mucocele. You get vascular tumors in the mouth as well. They're usually venous dilatations. You could get lymphatic dilatations in here as well. I mean, a cystic hygroma is a massive lymphatic malformation that usually involves the neck, but you can get extensions of this into the inside of the mouth as well. There's the classic Kaposi's sarcoma, you know, that vascular thickening of the gingiva here, common in AIDS and HIV patients. But remember other swellings in the mouth, swellings that have a major significance, and that's malignancy. So, you know, you feel any swelling in a tongue, then it's a squamous cell carcinoma until proven otherwise. You can get other rarer swellings in the tongue as well, some benign swellings too, but you know, you consider it squamous cell carcinoma until otherwise. And the other nodule you can get in the mouth are tumors of tonsillar tissue, lymphomas. This was non-Hodgkin's lymphoma of the palatine tonsil here, and you can see the mass that's developing in the tonsillar fossa. So you get tumors arising from the structures in there, you get tumors arising from bone, tumors arising from salivary glands, tumor arising from vascular or lymphatic tissue, and you've got your irritation fibroma. Now, I've mentioned up here there are several other intraoral nodules that have specific dental origins. There's one called the retrocuspid papilla, and I think it occurs on the lingual side of the upper teeth. Better check that one. But it's arising up between the teeth. And then there's this thing, the oral lymphoepithelial cyst. And it's a cyst that's arising in association with some lymphatic tissue. It's related to the branchial cleft cyst, I think, and because the cervical, the external one, is certainly related to the branchial clefts, and these are structures that have embryologic significance. A lot of the structures of the face develop from these. And then there's this one, the peripheral odontogenic fibroma. This is arising from cells of the periodontal ligament. And so it looks somewhat like, you know, an irritation fibroma, but it's arising in a different location because it's going to be associated with the periodontal ligament. Whereas your normal irritation fibromas are going to be in your buccal or lingual areas of the mouth. Then you get some of these things, lipomas, tumors of fat. They can occur in the mouth. There's a lot of fat tissue in the buccal surface, and there's also fat in the tongue itself, so lipomas can develop there. Traumatic neuromas, this is where there's been damage to a nerve, and a neuroma develops on that damaged nerve. Neurofibromas are different. Neurofibromas are tumors of Schwann cells on the nerve itself. And of course there's type 1 neurofibromatosis, where people have multiple cafe-au-lait spots on the skin and can have multiple neurofibromas on the skin as well. They come out later, but they can occur inside the mouth. I've said here, there's this little one, multiple small neurofibromas on the lips or the floor of the mouth. Should have you thinking of this condition, the multiple endocrine neoplasia syndrome. And as that name suggests, endocrine neoplasia. That syndrome, it's an autosomal dominant, but it's associated with neoplasia of several endocrine organs. So cancer of thyroid or other endocrine organs may be seen in this multiple endocrine neoplasia syndrome. So little neurofibromas on the inside of the lip of the floor of the mouth should have you thinking of that. They sometimes look a bit marfanoid. You know, it just means they're long and thin. And who was the American president they thought suffered from? Lincoln. They thought he suffered from Marfan syndrome. That gives you an idea of what they might look like without the beard. We talked of osteomas arising from the outer surface of the bone, and endosteal osteomas arising from the medullary surface. And if you've got more than one osteoma on the inside of the mouth, there's a condition called Gardner's syndrome that you should think of. And I think I've made a mistake before, because when I was talking about Marfan's, it shouldn't have applied to that. It should have applied to Gardner's. It's Gardner's syndrome that they can have a Marfanoid habitus. So I apologize for that, but it's Marfan's that can be associated with that. The thing about these people is that they can have multiple intestinal polyps, like Peutz-Jeghers, except that the ones in Peutz-Jeghers are just hamartomas. They don't have a high tendency to develop malignancy, but the ones in Gardner's have a much higher tendency to become malignant. So multiple osteomas, more than one osteoma on the inside of the mouth, do some x-rays, check it out, consider they might have Gardner's syndrome, ask about family history of bowel cancer, and you may make that diagnosis in your patient. Let's just have a quick look at these images at higher view before we finish. There's your traumatic fibroma epilis, usually irritation. Here's another example. You can see the poor teeth this guy has. It's no wonder he's going to get some irritation like this. Remember, it's not a tumor, it's a hyperplasia. There's another one there on the buccal mucosa. These were your tori. Try looking up that link there. This was where that image came from. They're saying inappropriate bone growth in the roof of the mouth, slow growing, non-malignant, can interfere with chewing and denture placement. Well, you can imagine it's going to interfere with denture placement. Patients suffer from bony exostosis, similar to torus, though along the ridge of the upper jaw, so it's usually on the cheek side of the upper jaw. We call those exostoses. This was a mucocele, blockage of a salivary gland here, very common. As I say, they can resolve on their own, or you can incise and drain them. Here you've got some venous, prominent benign venous dilatations in the floor of the mouth. Some people have, I think there's a condition called caviar mouth. I must look that up again, where you get really prominent venous dilatations in the floor of the mouth. And there's a little cysts like this, they're salivary gland cysts as well. That was the Kaposi's that we talked about. Remember, that's herpes virus 8 infection in AIDS patients. Can rarely get it in other immunosuppressed patients. Any lump in the tongue, especially if it's ulcerated like this, just feel it between your fingers. It'll feel rock hard. That's a squamous cell carcinoma. And that was just a picture of peritonsillar enlargement, lymphoma, non-Hodgkin's lymphoma for palatine tonsil. So, nodules in the mouth, an interesting topic. There's a lot of unusual things there. Usually they're of significance. Just try and remember some of these syndromes. Multiple endocrine neoplasia syndrome and Gardner's syndrome. Remember, that's the one with the Marfanoid habitus. And just some nice pictures. And go to the Exodontia site and have a look at their section on tori and exostoses. Thanks very much.